July 8, 2015, it is best to plan ahead before anesthesia and surgery for very old dogs such as this golden retriever. She is 14 years old and has the right head tilt. So if you plan ahead, your surgery and anesthesia will be shortened, and you don't have to worry about the dog dying from a longer duration of anesthesia. So this is the record of anesthesia and surgery for Toa Payoh Vets, and you can see I gave the IV drip, antibiotics, and spasmogesic before surgery. Then check the right eye. Under GA as to why the third eyelid is prolapsed. Then extract the rotten teeth. Do ear irrigation. The fluorescent stain to check for eye ulcer on the right eye, if any. Blood test I advised, but the owner declined. This has to be recorded down in case of any misunderstanding later on. Now, ear ointment. Now, Stomagil is for the mouth infections. Vitamin B is to boost the immune system. Penicillin, short dosage, short duration for reducing the inflammation together with antibiotics given. So in this example, which I'm illustrating for the video on speed, accuracy and completeness in veterinary surgery. Now, for very old dogs, obviously, you just use isoflurane gas only. Don't give sedation IV or IM. And of course, informed consent to let the owner know that the anesthetic risk is very high. And of course, you should advise blood tests to check, to screen the health of the dog, but for medical cause, the owner has decided not to do the blood test. So overall, you can see once the anesthesia is given, it will be recorded here. Now, keep good records so that if there is complaint on a litigation, you can show that you have done a good medical record keeping. So now instead, there is no sedation, so the time of injection of drugs will be none in this case. That means the sedation. Isoflurane gas first given will be recorded by the assistant, and then isoflurane gas stopped. So if this can be finished within 15 minutes, then it's unlikely this 14-year-old dog would die of anesthesia. Now you can see the tooth extraction. The first tooth extracted, the time will be recorded down, and then the completion of dental work will be recorded down. Name of the vet and the signature. This dosage is actually meant for IV or IM sedation, but in this case none will be given, so it will be not recorded down. Then the performance of the vet, how fast or how slow he does his work will be recorded down and assessed by me. For example, C minus B. C minus B is isoflurane gas usage. Now, if you can complete the job in 15 minutes and you do 30 minutes, that means there's something not right for this vet, because the duration of anesthesia is too long. Probably maybe lack of planning, because you haven't planned what to do. So you keep looking for your injections like subconjunctival gentamicin injections, or you start looking for antibiotics injection or ear flushing equipment or ear irrigation syringes. So obviously then your anesthesia will take a longer time, and sometimes the old dog, like this very old golden retriever, passes away of heart failure. In conclusion, speed, accuracy, and completeness is very important for old dogs surgery or anesthesia. And knowing what to do, like for example using only gas isoflurane in very old dogs is important, but professors normally recommend some sedation first by IV or IM, and this will be okay for young dogs or healthy dogs, but for very old dogs such as this one, it's best not to give any IV or IM sedation.